Hello and Yalimadat everyone. Welcome to our webinar, Unity in Immunity, How to Stay Healthy This Respiratory Season, a part of Your Health is Your Wealth series. My name is Zain Velji, and I'm a registered nurse with the Master of Public Health. I'm currently a consultant for the Government of Alberta, and I also work at the Urgent Care in downtown Calgary. I also serve as a health promotion member on the Aga Khan Health Board for the Prairies, and I will be your moderator for today's webinar. The goal of this webinar is to share valuable information on respiratory conditions such as influenza, COVID-19, pneumococcal disease, and RSV. We will also learn about how we can stay healthy and protected during this time of the year. Our speaker will also discuss up-to-date information on preventing infection, vaccinations, and what to do if you are sick, including testing and treatment. They will address commonly asked questions on these topics. Before we start, we would like to thank all of the volunteers who have helped to make this webinar possible. I would like to acknowledge the contributions of Dr. Shehzad Kassam, with previous contributions by Dr. Zain Chagla and Dr. Hamida Meghani in developing this webinar. I'd like to start with a land acknowledgement, where we acknowledge the Indigenous peoples of all the lands that we are situated on today. While we meet today on a virtual platform, we would like to take a moment to acknowledge the importance of these lands, the ancestral and unceded territory of all the Inuit, Métis, and First Nations people across Canada that call this nation home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. Before we get started, we would like to inform the audience that any information that's provided in this webinar should not be considered specific medical advice and is not intended as a substitute for medical professional help, guidance, diagnoses, or treatment. We remind our audience to seek the advice of your physician or other qualified healthcare providers with any questions you have regarding your medical care. The healthcare panelists are not affiliated with any specific products related to this presentation, nor do they endorse them. I now have the pleasure of introducing you to our speaker for today's session. Dr. Shehzad Kassam is a medical doctor specialized in public health and preventative medicine from the University of Alberta. He also works as a family physician in Calgary with a focus on chronic diseases, HIV, and refugee health. We want to thank you for taking the time to be here with us today. Over to you, Dr. Kassam.
Thank you, Zain. Yalimadat, everyone. So as many of you know, fall and winter is the time when we see a lot of respiratory illnesses around us. So we wanted to make sure that you have the tools you need to keep yourself and your loved ones safe during this time. During the season, but also all year round, there are many ways to stay protected from these infections. Washing your hands regularly, covering your coughing and sneezing, cleaning and disinfecting high-touch surface areas like doorknobs and handles, staying home from work, school, and even Kane if you're sick, wearing a mask if you must go indoors, and getting vaccinated. Sometimes life can pose challenges and it's hard to do these things. What does a young parent do who is sick, but they need to care for their children? What about someone who must go to work as they cannot take sick time? What about your nani and nana needs help with groceries or their medications? So doing your best with these protective measures, and even during the season, let's normalize wearing our masks in Kane, staying home if we're not feeling well. While it may not be mandatory as it was several years ago, masking can still play an important role in protecting yourself and others against these infections. Not only can you prevent yourself from getting sick, but you will also help limit spread to other people. The key is that the mask must fit well and cover both your nose and your mouth. If you are not well or wish to not get sick, wearing a mask indoors around other people will be the best option, and can also be helpful if you are outdoors amongst large crowds. Let's talk about vaccinations. So, what are vaccines? Vaccines are products that are used to teach our bodies how to fight against diseases. Each vaccine is made out of either a virus or a bacteria, and there is either a dead version of that bug in there or a weakened live version of that bug. And our body is exposed to it in a vaccine. It learns to build its immunity. So when that exposure happens of the real disease, it can prevent us from getting sick from it. Unlike most medications that we take, vaccines are not meant to treat something after we get sick, but rather to prevent us from getting sick in the first place. Similar to how we must eat well, exercise, have good sleep, reduce stress, not smoke, vaccine is another tool for prevention. A lot of concerns around vaccines are related to safety. Vaccines are extremely safe, with most reactions or side effects being minor, and the overall benefit of getting the vaccine is much higher than the risks. We'll go into more detail about safety and side effects later in the session. Vaccines are also very effective at what they do. The main goal of vaccines is to protect the individual from getting the infection. While they are effective, there's still a small risk that people can become ill even after they become vaccinated, but it's still effective in reducing how severe the infection will be. So your symptoms may be milder, you may recover quicker, there's less chance of needing to go to the hospital or potentially even dying from that infection. The really incredible thing about vaccines, though, is that it not only prevents infection for the individual, but also helps protect your family, your friends, and others around you. That's why we named this presentation Unity and Immunity, because unlike a lot of things in healthcare, it's others who benefit as well from it. If you are vaccinated, you're less likely to get sick and therefore cannot pass that illness to other people. There are also certain people in our community who are not able to get vaccinated due to specific health conditions. So everyone else being vaccinated around them can prevent the disease from getting to them. So do vaccines work? Absolutely. Before vaccines, many diseases were spreading at very high rates. For example, in this graph, measles vaccine came out in the 1960s and slowly became part of our vaccine programs across the country. Before that, there were numerous cases. Many older members of our Jamaat actually might remember when they or others around them had the measles infection. But after the vaccine was introduced, we slowly got numbers declining when there was one dose of the vaccine and then two doses to a point where we basically had just a handful of cases in the country year after year since then. The unfortunate thing is that in order for vaccines to work, people need to get vaccinated. What happens if we don't get vaccinated? We've seen in the last year or so a lot of cases of measles rising again across the entire country. We've seen it in Ontario, in Alberta, certainly in other parts of the world as well. And this is due to people not wanting to get vaccinated. Some may be unable to due to specific health conditions. Some may be unable to because of access to vaccines. But more often than not, people may be concerned around safety. They may not trust the healthcare system or their government. There may be just a lot of confusion and misinformation around vaccines. And this is why we're starting to see a reemergence of infections like measles happening again when we thought we would never have to see them before. So just to give a bit of a brief overview about measles, because maybe people have heard about it, but just not had a chance to read into it a bit more. So measles is a virus. It has returned around Canada in the last year, starting in Ontario last fall. It does spread throughout the air quite easily and can make a lot of people sick around them if they're not immune. For something like influenza or COVID, there was a lot of discussion around staying 6 feet apart or 2 meters apart. That is because those kinds of infections can only spread a certain distance. With something like measles, it can spread around and stay in the air for a long period of time. Even for someone who is sick, if they leave the room, that illness can still stay in the air for up to 2 hours after they've left. So there's a chance that a lot of people can be sick if they're exposed to it and if they're not immune. In terms of how it may present in terms of symptoms, typically people will get a fever, then they may develop a cough, runny nose, red, watery, itchy eyes, like pink eye. And then a few days after that, we start to see a rash. The difference about the measles rash is that it can start in the head and in the face, and then it goes down to the rest of the body. Typically, we might see the first few symptoms of measles are similar to other virus infections like influenza, like COVID. But then it's that rash that really makes it distinct. And that's what can tell people that this is likely going to be measles. In terms of vaccine, so thankfully there is a vaccine for it and it's extremely effective. If people get 2 doses of the vaccines or if they're known to be immune, there's about a 95% chance of being immune from the disease. In our vaccine programs across the country, most provinces will have it that children at 12 months of age and then at 18 months of age will get a vaccine. So typically those 2 doses. There's been a lot of differences across the provinces about those who were born before 1970. Typically, as I'd shown before, there was so much measles spreading around before that people were likely exposed or maybe had gotten infected themselves, and therefore we believe that they were immune. It's important to check in your own province or territory whether you may be eligible to get an extra dose, whether you may be traveling to an area where there's measles spreading, or whether your province may make it eligible for you to get one if you're born before 1970. But there's a chance that we can still continue to get a vaccine even at that age to ensure that we're all immune from it. So we've touched on a few diseases that can be protected from vaccines, but I just wanted to show that there are a lot of different viruses and bacteria that have a vaccine developed against it. So we talked about measles already, but there's also things like chicken pox and shingles, hepatitis, rabies are a few examples of different viruses. For bacteria, there's things like meningitis, which is a brain infection. There's pneumonia, and tuberculosis, which are different kinds of bacteria that have vaccines for them. And even there's certain kinds of cancers. So human papillomavirus is still a virus, but it causes cancer like cervical cancer. And so we've seen that with vaccines being developed and put into our provincial programs, that it's actually helped prevent cancer as well. So there's a lot of benefits from getting vaccines beyond just preventing the infection. The picture here shows a smallpox vaccine and a tuberculosis or BCG vaccine that many members of our Jamaat who have come from far and wide may have received in their countries. These aren't vaccines that we typically give in Canada, but just something to share in case you can relate to it or maybe any of your family members have that. So next time you speak to any of your family members or friends who are born outside the country, talk to your grandparents, parents who may have got this. It's just an interesting thing to note. So let's talk about vaccines going across our lifespan. So other than COVID or flu vaccines, many of us actually don't remember getting vaccines in childhood, just because so many of these vaccines were given before the age of 2 years. It's a very busy slide here, but the main thing I wanted to share is that there's a very regular schedule. It may differ across different provinces, but typically from the ages of 2 months onwards, at regular intervals, there's a series of vaccines that your province or territory may be offering, and it's typically free, that you can get for your children. So for anyone who has young children, who are planning to have young children, it's important to keep up with those appointments and just look at when the scheduling is for your own province or territory, and just know that there's so many diseases that we're protected from such a young age that it's important that we continue doing that, and it'll help protect your child for the rest of their life. Another group that's important in our community are those who are expecting. So are vaccines safe in pregnancy? Yes. Most vaccines are safe in pregnancy. There's two types of vaccines that may be typically offered or recommended in your province. One is this tetanus, diphtheria, pertussis, or Tdap, which is often given towards the beginning of the third trimester of pregnancy. And this is mainly to protect the infant from getting sick, as they cannot get this vaccine before a couple months of age. The other one is the RSV, which is one of the viruses that we will speak to that are seasonal. There's a new vaccine that's been made available to be given in pregnancy, again, around the same time. Typically, it's meant to be given 4 weeks or so before you deliver. Some provinces may offer it free, some may not. Again, it's important to check to see what your province offers, but these are the two vaccines that are typically recommended specifically in pregnancy. Some vaccines cannot be given in pregnancy. For example, things like measles or chickenpox. At the beginning of my session, I was mentioning how there's a dead version and a live weakened version. We don't know the safety of those live weakened versions in pregnancy yet. So that's why they're not typically given and they're not considered safe at this time. So the most important thing is that if you're planning to get pregnant in the future, it's important that you get up to date with all your vaccines before that so you can protect yourself, your baby, and your family. So we've talked about childhood, we've talked about pregnancy, but let's talk about what vaccines all adults can get. Since most of us think vaccines only happen in childhood, it's important that we speak to what we can do as adults as well. Again, most of the time we're focused on these annual influenza or COVID shots that we get. But the fact that there's so much diversity within our Jamaat, coming from different countries where their vaccine and healthcare systems may be different, there's a lot of vaccines that we in Canada consider to be essential in childhood and that we can offer free of charge. So it's important to check if you, as an adult, have missed any of those or maybe don't have documentation of that, that you catch up with the childhood vaccines that you may have missed. If you're not sure, you can certainly speak to your public health office or center in your area. We'll touch on that a bit more later as well, but just ways that you can find out whether you're up to date and that you can take those steps to become immune. We talked about influenza and COVID that we get every year, and we'll go into that more as well. The other vaccine that typically people don't know much about is this Tdap one. Commonly, it's the one that is missed because it needs to be given as a booster every 10 years or so. Some of you may have heard about it if you've gone to the emergency room or to a walk-in clinic. You maybe had a cut on your finger or something, and they might ask you, "Have you had your tetanus shot yet?" And you might be wondering, "Why am I getting a vaccine if I've just had a cut and they just need to fix that?" This is the kind of a vaccine that's given in those scenarios, and it's meant to be kept up to date every 10 years because parts of this vaccine do become less effective after several years. So you might find that this is one that you're offered in those settings, but also maybe we can be a bit more proactive and try and make sure that we're updated ourselves. For the older members of our Jamaat, there are several vaccines that they're eligible for based off of age. These are meant for typically healthier older adults. These vaccines can also be given to those who are younger, but may have certain health conditions. But we'll go into focus on the healthy older adult for now. And you can certainly check if you have any specific chronic health conditions or if you're immunocompromised to see in your public health office or pharmacy which vaccines you may be eligible for as well. So the ones that we have here are shingles vaccine. It's a type of disease that maybe many of you have heard about, or maybe you've heard other people get. Typically, there's a bit of a burning and itching sensation, and then after that, you'll develop a rash. It's related to the chickenpox virus as well. So that's a vaccine that can be given to older adults. There's a vaccine for pneumonia. There's one that's been given in childhood, but there's also one that's now being given to older adults as well to prevent bacterial pneumonia. The influenza vaccine, so the one that we're given every year, there's an option for a high dose vaccine, again, depending on each province that you can receive. And this will be better because influenza or the flu can be quite severe if you're getting older in age. So they do have a specific vaccine for that. And the other one is RSV, Respiratory Syncytial Virus, but we typically say RSV because it's simpler to say, is another seasonal virus. And a lot of provinces do offer that vaccine if you're much older. Again, it's important to check if you're eligible to receive that for free or whether your insurance covers it. So earlier we spoke a bit about vaccine safety, and it's important that we address this because it has caused a lot of fear in people and may lead to avoid vaccination. So are there side effects? Yeah, there are, or there may be at least in certain situations, similar to other medications as well. Everything our body takes from health is not always perfect, but the good news is that the vaccine side effects are often not severe. The soreness at the point of injection, some redness, swelling, you may develop a fever or chills. You may have a rash at that location. You may just feel low energy and tired at the end of the day. Those are all very common and they are not severe side effects. These typically will go away on their own and don't often involve any sort of intervention or treatment. Severe reactions can occur, and I just wanted to express my empathy for those who have had severe reactions before or they know of other people. It's not an easy thing to go through, but I just wanted to reassure everyone who's listening today that these things are quite rare. And working in public health, we are involved in tracking these things and monitoring. So we do get a sense that at a large level, when we look at hundreds of thousands of people, and that the vaccine developers are looking at this too, they are very rare. Typically, you might get a vaccine and you're asked to wait 15 to 30 minutes after to monitor for some of those more severe side effects or allergic reactions, and it's important to do that. If anything does come up hours, days, or weeks after getting a vaccine, it's important to speak to a healthcare professional about that. Some of those things may be related to the vaccine. Some of those things may just be a coincidence. Your healthcare provider and your public health teams in your province will look into those things and see whether that vaccine and that reaction are related. But just to reassure you again, the side effects are common that are not severe. The severe ones are very rare, and the benefits of getting a vaccine are they do outweigh the risks. So as we approach the fall season, and the main reason for giving this presentation is that most provinces do run a fall immunization program specific to things like influenza and COVID-19. These are just some of the graphics that we have in Alberta about some of their marketing that they've done over the last few years. So you may notice some of these things where you live. So speaking to the two conditions that we wanted to focus on, COVID and influenza or the flu, COVID is continuing to spread all year round just because we've gone past those last few years where there was a lot of different changes with the policies around us or what we needed to do in terms of what was mandatory. We are still continuing to see COVID-19 spread around all year round, and it can still be quite severe. We're also seeing the seasonal viruses like influenza coming around now, typically at the end of fall, or sorry, at the beginning of fall and going until the end of spring. So that's why we want to focus on these two for the session. Typical symptoms of both of them are you may get a sore throat or a cough, your nose may be runny or congested, you may get fever or muscle aches as well. And with COVID, you may still get that loss of sense of smell, which was quite common with that. But these are the ones that overlap between the two different viruses. These viruses can have very severe impacts on the extremes of age, so the very youngest and the oldest members of our Jamaat, as well as those who have certain medical conditions that have weakened immune systems, sometimes due to the disease itself, or sometimes due to certain treatments that they're getting. So during this season, it's important that we take precautions not only for ourselves, but also to protect those who are most vulnerable, not just by taking things like washing your hands or wearing a mask, but also by getting vaccinated. Going over into the COVID-19 vaccine, so there are still new vaccines being developed because there are new variants that are coming out, even if we may not be hearing about it as much in the news nowadays. It's typically eligible for those who are 6 months of age or older. So if you have young children, it's important to get them vaccinated if they can. The Canadian guidance suggests that there are high risk groups based off of age, where they live, certain medical conditions that these vaccines are recommended for, as well as those who may be most likely exposed, like those in healthcare. As well as there's a suggestion or recommendation to say that if you are over the age of 80, live in long-term care or senior home, or if you're immunocompromised, you may actually get 2 doses of this vaccine per year. It depends on each province, so it's important to check with that. But for the most part, those who are high risk are recommended, and everyone else may get it as well. For the flu vaccine, there's a new vaccine each year as well, and it's meant to match the current strains of influenza. Because the southern hemisphere countries like Australia have a different season than us, they typically will get fall and spring while we're going between spring and fall. So when we see what kinds of viruses are spreading at that time in this year, the vaccines that are used in Canada are related to those that we see in those other countries. And that way we know what will be likely to spread in our country as well. Just like COVID, this is also eligible for those who are over the age of 6 months. So again, recommended for those who can get it. If it's your first time getting the flu vaccine, and there's a lot of people who may not have had this in the past, and they're under the age of 9, they can get 2 doses at least 4 weeks apart, and everyone else after that can get 1 dose per year. And this is recommended for everyone as well, with the focus on higher risk groups. So we spoke about this briefly as well. Another seasonal infection, which is RSV. This comes around this time of year as well, just like influenza. Most common and most severely, it happens in young children under the age of 2. In fact, everyone who's under the age of 2 has most likely been exposed or been sick from this virus at some point in their life, which is quite interesting. And it also affects older adults as well. And this is a big reason why there's a vaccine to prevent this illness for those who are older. Similar symptoms may present as other virus infections with your nose, your throat, your lungs, but typically there might also be something like wheezing that you might hear about, which happens in asthma. But this is something that might happen for younger children who are infected with RSV. For prevention, again, these things are different, may differ across different provinces and territories, but there's a vaccine that's eligible for those who are older, the vaccine who are eligible for those who may be pregnant. As well as there's a different kind of injection that we won't go into too much detail, but it's specifically meant for young infants who have very distinct health conditions. Oftentimes, if they're premature, if they have certain lung or heart conditions, they may get a certain type of injection called a monoclonal antibody. And it's also used for prevention as well, but the focus is for the vaccine for those who can get it. As we've spoken about, kids are very likely to get sick during this time of year. You may have heard of this happening around schools or daycares. And as we've spoken about a lot of different preventive measures, getting the vaccine, especially because they can get it after the age of 6 months, is extremely important. Some high-risk infants can get special treatment like that monoclonal antibody for RSV. But typically, if your child is sick, it's important to keep them at home. Um, a lot of rest and fluid, and similar healthy habits of staying well, getting good nutrition, using over-the-counter medications if they need to for pain or for fever, and doing some suction or saline options for their nose can certainly help them feel better. While most children do get better with a bit of time and rest, and some of these interventions, if there's ever concerns around your child is just not acting their usual self when they're sick, if they may be confused, if they're extra sleepy than they usually are, if they're not eating or drinking very well and seem dehydrated, if there's difficulty in terms of breathing, where they're using different muscle groups, or you're just concerned overall with how they're looking, make sure you keep a low threshold and seek medical attention if you need to, either through your primary care provider, urgent care, or even the emergency department, and get them checked out. So what should you do for COVID and flu vaccines? So every province and territory might be different this year, but if you have an option to do so, please pre-order and book your COVID and 19 and flu vaccines for this year. Um, Otherwise, if you don't need to do those things, you can speak to a pharmacist, speak to someone in public health like a nurse, go to your primary care provider, and find out how you may be able to get these vaccines for yourself in your province or territory. So what should you do for all other vaccines? As I mentioned, especially as adults, it's important that we're caught up on all of our childhood vaccines, if we've missed any or if we just don't know if we've had them or not. So go to your local community or public health office or access online records if they're available in your province. Save a copy of those vaccine records. I keep a copy on my phone and a printed copy at home as well. It's just good to have in case you're not sure whether you need to catch up on something or whether you're up to date. Get those vaccines if you or your family are not up to date. And you can also check the Can Immunize app as well. And we've left the link to the website here.
Thank you, Dr. Kassam. I'd like you to answer some frequently asked questions about vaccines and the respiratory season.
Sure.
Why do we need to keep getting a new COVID-19 and flu vaccine every year?
Yeah, so as I mentioned, there are new variants of COVID-19 and different new strains of influenza each year. So the vaccines that we've had in the past are not going to be effective in preventing these new viruses that are spreading. So by getting it each year, we can ensure that we're immune for this season or for this year.
Influenza is not so serious, so why do I need the vaccine?
Yeah, so we might think that influenza is not a serious infection, but that's not necessarily true. As I mentioned earlier, this bug can be very severe in young children, in older adults, and they can get very sick from influenza each year. They may be ending up in the emergency department or in the hospital, potentially even dying from that infection. So even if you don't fall into those two age groups of very young or very old, getting the vaccine will help prevent you from getting sick and spreading it to those who might have more severe outcomes.
Isn't natural immunity or getting sick from the infection better than taking the vaccine?
It's a good question, and it's come up quite a lot, especially in the early days of COVID and even with measles right now. So getting the infection does lead your body to having some immunity if you're exposed to the disease, just like you would get with the vaccine. And your body does learn how to fight it off in future exposures. We don't want to deny that. The thing is that there's also risks associated with getting the infection itself that most people don't realize. I remember early on in the COVID pandemic, people were having COVID parties where they would get together in groups. One person may be sick and they were hoping to get sick from them to get the natural immunity from getting infected and then feeling like they are immune from that. Um, while that might have been leading to some immunity, a lot of those people were actually getting quite sick. And I remember some people were getting admitted to the hospital or ICU. For measles, we're seeing the same thing right now in Alberta, especially. If you get the infection, there are complications like getting an ear infection, pneumonia, very serious and fatal brain infections, and it can impact your immune system as well. So while you do get immune in the future, you're putting yourself at much more risk than just by getting the vaccine. At the end of the day, you're getting exposed to the same bugs. And if your body can build immunity by a vaccine rather than getting sick, that is what we would recommend.
Vaccinated people are still getting sick, so how do we know that the vaccine actually works?
Yeah, so vaccines, just like anything else in medicine, are not perfect. They are very effective, but they're not perfect. Most of the time, they will prevent infection, as I've mentioned. Depending on how many people around you may be sick, or if you're being exposed quite often, or if you have certain health conditions that may make you more likely to become sick, you can still get the infection even after getting vaccinated. The benefit is that we know that, even if you do end up getting sick from the infection itself, your illness is going to be less severe. So the symptoms are not as bad. You're going to recover quicker. You're less likely to spread it to other people, actually, less likely to go to a hospital or die from the illness itself. So again, vaccines are not perfect, but they're very effective. The goal is to prevent you from getting the infection in the first place. Even if you do get sick, there's still a lot of benefits to having been vaccinated than to not.
I'm pregnant, so aren't the flu and COVID-19 vaccines not safe for me and my baby?
So both the COVID and flu vaccines are that dead, weakened, or sorry, the dead version of the virus. All those kinds of vaccines, which are the majority of them, are safe in pregnancy. So if you're pregnant, both vaccines are safe for you and the baby, and it's actually recommended to receive them if you can.
Doesn't the COVID-19 vaccine cause other health problems such as heart disease, clotting, fertility problems, etc.?
Yeah, it makes sense to wonder about these side effects. Anytime a new vaccine or medication comes out, people want to know about some of these serious problems. So with heart disease, people have talked about things like myocarditis, which is inflammation of the heart muscle. I've heard, yeah, about clotting as well and fertility problems. The thing is that the COVID infection itself is more likely to cause these issues than the vaccine. Some of the earlier vaccines that may have been circulated at the time that are no longer being offered now, there was a bit of a rare clotting condition that was coming from them, still less so than getting the infection itself. So we use different vaccines that have a lesser or negligible risk now for that. So again, I would just say that, while it is understandable to worry from this, and if you yourself had issues with any of these things, and either your health provider or you yourself feel that this is coming from the vaccine, I understand it's a very difficult thing to go through. But just to share that the COVID infection or the flu or other infections can cause more health problems than the vaccine itself. So it's recommended that you get those. The benefits are far more important than the risks associated with it.
I know someone who had a very bad reaction to a vaccine. Why should I put myself or my family at risk of getting the same thing?
Yeah, so once again, I'm sorry to hear for anyone who's had to experience that themselves or someone else they know. It would make me nervous about getting vaccines. It makes a lot of people nervous about getting vaccines. Then, just to reiterate again, that vaccine side effects that are very serious are extremely rare. They look at these things when they're making the vaccine. They look at these things when the vaccines are out in the community. They look at these after millions of people have had vaccines. It's very rare to have a serious allergic reaction or another severe reaction otherwise. So again, the disease itself is much worse to get those kinds of potential illnesses than the vaccine itself. It's important to talk to your healthcare provider about these things if you are worried about it, or if you or someone you know has had a bad reaction. But once again, they're very, very rare, and most people should get the vaccine if they can.
Don't vaccines have a microchip in them to track us?
No, vaccines do not have a microchip in them.
Does the measles vaccine cause autism?
No, so measles vaccines do not cause autism. There was a really big research study many years ago that said that. But since then, when they've looked at the science, they took the study away. They said it was not done correctly. There's been more research since then that's looked at millions of children, and they've shown that there's no link. So if people believe that the MMR or measles vaccine in general cause autism, they do not.
We would like to leave you all with some very helpful resources. For the latest updates and information, visit iicanada.org, where you'll find provincial vaccination information, FAQs, and a variety of webinars on health-related topics. For personalized support and resources, you can contact the Access line by scanning the QR code or dialing the phone number on this slide. That brings us to the end of today's session. I would like to thank Dr. Shehzad Kassam for sharing his knowledge and expertise with us. Lastly, thank you to our audience. We hope you enjoyed today's webinar and learned a few things to help keep you healthy and protected this respiratory season. We would appreciate you filling out an evaluation form to provide feedback on the webinar. Your feedback is important to us and it allows us to improve our programs and develop future programming. Please scan the QR code for the evaluation form. We will also follow up with an evaluation form via email for those who have registered. Until next time, Yali Madeth.